Bismillahirrahmanirrahim. Hello everybody. So here we have another question. A 23-year-old woman, gravida 1 para 0 at 12 week of gestation come to the office for vaginal bleeding after intercourse. So we will highlight here this point. The patient having vaginal bleeding after intercourse. She had intercourse 12 hours ago and has since noticed blood in the toilet after urination and bright red blood on the toilet paper. She has no medical history and take no medication. The patient reports occasional alcohol use prior to pregnancy, but not tobacco or illicit drug. Blood pressure is 120 by 70 mm of Ag. Pulse is 65 per minute. Fetal heart tone is normal by office Doppler. We will also highlight it here. Pelvic examination show external genitalia and a thick yellow male odor discharge. Thick yellow male odor discharge in the vagina. The cervix is closed and bleeds after being touched with a cotton applicator or swab. No masses are noted by manual examination show in a large uterus, but no cervical motion tenderness, adnexal masses or tenderness. Which of the following is the most likely diagnosis? So, choice A, acute cervicitis, choice B, bacterial vaginosis, choice C, cervical polyp, choice D, complete hydatidform mole, choice E, inevitable abortion, choice F, threatened abortion, choice G, von Willebrand disease. So as I highlighted here the option, I will also write it here. First, the patient complained that I have vaginal bleeding after intercourse. So this is called postcoital bleeding. The bleeding after intercourse is called postcoital bleeding. So the vaginal bleeding after intercourse. So this is the first hint. Based on these hints, we will easily know that what is the diagnosis of the question. This is the first hint. The second hint is that on Doppler the fetus heart rate is normal. Doppler fetus heart rate is normal. Fetus heart rate is normal. This is the second hint. Come to the third hint. The third hint shows that on pelvic examination there is a thick yellow male odorous discharge. Male odorous discharge. This is the third hint. The fourth hint is that with after being touching with a cotton swab, the cervix easily bleed. Cotton swab, cervix easily bleed. This is the fourth hint. So based on these four hints, what is diagnosis of this question? Diagnosis: first, vaginal bleeding after intercourse. Second, on Doppler ultrasound, the fetus heart rate is normal. Third, on pelvic examination, there is a thick yellow male odorous discharge. After being touching on the cotton swab, the cervix easily bleed. So the diagnosis of this question is acute cervicitis. Acute cervicitis. So here the correct option is option A, acute cervicitis. Acute cervicitis because this patient presentation of postcoital bleeding is also I explained to you that what is postcoital bleeding. The bleeding after intercourse is called postcoital bleeding, and a thick mucopurulent discharge is most consistent with acute cervicitis, which is caused by chlamydia trichomatis and Neisseria gonorrhea. Acute cervicitis is diagnosed clinically by a pelvic examination that show a mucopurulent discharge and a febrile cervix that bleed easily on contact. So the treatment option for acute cervicitis is with empiric azithromycin and ceftriaxone. This is the treatment option for the acute cervicitis. Come to the choice B, bacterial vaginosis. So in bacterial vaginosis there is a thin gray discharge with fishy odor. This is the differences between the cervicitis and the bacterial vaginosis. On bacterial vaginosis there will be a thin gray discharge with a fishy odor. Come to the choice C, cervical polyp. So in cervical polyp is seen during pelvic examination as red lobular structure originating from the cervix. Choice D, complete hydatiform mole. So in hydatiform mole there will be no fetal heart tone, as already I know I noted here, and I highlighted here that on office ultrasound the fetal heart rate is normal. So on complete hydatiform mole there will be no fetal heart tone. Come to the choice E, inevitable abortion. So an inevitable abortion present with vaginal bleeding, cramping, and a dilated cervix, open with product of conception visualized at the os. Choice F, threatened abortion. So, patients with a threatened abortion typically have bleeding originating from the uterus rather than from a fragile cervix. Choice G, von Willebrand disease. So, patients with von Willebrand disease have postpartum hemorrhage. There is no association with postcoital bleeding. So let's revise again why the choice A is the correct one, because as this patient come to the office complaining of that 12 hours ago, after I intercourse with my sexual partner, I have some vaginal bleeding. This is the first hint. The second hint is that on office Doppler ultrasound the fetal heart rate is normal. On pelvic examination there is a thick yellow malodorous discharge, and when we touch the vagina with a cotton swab it bleeds easily. So the diagnosis of this question is acute cervicitis, and the treatment option for acute cervicitis is azithromycin and ceftriaxone. This is the treatment option for this acute cervicitis.